Good afternoon, and thank you once again for joining us. I just wanted to give a quick update with some numbers and then an opening statement. As of this morning at Northern Light hospitals across the state, we are currently taking care of 53 inpatients within our system. 3 of those are at A.R. Gould Hospital, 34 at Eastern Maine Medical Center, 3 at Maine Coast Hospital, 1 at Mayo Hospital, 10 at Mercy Hospital, and 2 at Sebasticook Valley Hospital. In addition to those numbers, we are also caring for 56 patients who are positive for COVID-19 at their home through our home care and hospice division. The stark reality of this pandemic continues to be the virus's ability to affect seemingly healthy individuals in extremely harsh ways, keeping us from work and loved ones, requiring hospitalization for prolonged treatment, and even death. Northern Light Health is not immune to these realities, having our own employees suffer at the will of an unseen enemy in each of these categories. Much has been made of the lower number of hospitalized patients with COVID-19 across Northern Light Health. Some of this is due to recovery, but many of these individuals remain hospitalized but are no longer categorized as having active disease. And sadly, a precious few have died while under our care. We mourn the loss of life and offer our sympathies to the family and friends they leave behind. We remind everyone of the seriousness of this disease, and in remembrance of the dead, ask for your continued vigilance. Wear your face coverings in public, limit gathering outside your own household, stay 6 feet apart, and wash your hands frequently. I'm going to turn it over to Paul to talk a little bit about some brightness in this darkness. Paul?
Thanks, Dr. Jarvis. So today we're delighted to report an update on our vaccination clinics for Northern Light has surpassed the 10,000 doses administered mark. Those doses being administered to about 7,000 people, meaning that 3,000 have received their second and final dose. So that's been a significant effort statewide throughout Northern Light. And today, A.R. Gould Hospital in Presque Isle is administering vaccine to community healthcare workers who are not Northern Light employees or part of our medical staff, but our community healthcare providers, and EMMC will be joining that effort on Saturday as we start that process of expanding the vaccination of healthcare workers beyond our health system. So we're delighted to be able to do that. In addition to those numbers that I shared, we've already vaccinated about 600 non-employed healthcare workers who provide services at Northern Light in addition to our employed staff. Dr. Jarvis?
Thank you for that, Paul. Yesterday, the governor announced that there would be changes made to the vaccine plan. We are eagerly awaiting today's expected announcement from the governor's office. We have, from the beginning of the pandemic, we will follow their, as we have from the beginning of the pandemic, we will follow their guidance as well as the guidance of the Maine CDC. As it will take time to operationalize whatever changes will be made to the vaccine rollout, we ask for your patience. We will communicate any changes and what, if anything, the general population needs to do in response to those changes. We are asking you to please have patience and to please not reach out to our hospitals and practices as we have no further information on that. And with that, we will open up for questions.
Okay, thank you, Dr. Jarvis and Paul. We'll start with Patty White, Maine Public Radio. As soon as you're unmuted, you can go ahead and ask your question, Patty.
Thanks very much. Can you just tell us a little bit more about your reaction to Maine potentially expanding who is prioritized for vaccinations? I mean, what do you think about opening it up to people who are 65 and older and people with underlying conditions?
Well, Patty, as I said, we are eagerly awaiting the ability to start vaccinating people outside of just healthcare workers. We know that this is how we will get through this pandemic in the long run, and so that's exciting news to us. We are concerned about operationalizing that. Particularly, we do not want to see what we've seen in other states where without good guidance and really well-received communication, that there's chaos in that. And so we will continue to work diligently to make sure that any plan that happens is a sound plan and one that the general population can follow so that we can make sure that we are safely and effectively vaccinating as many people as quickly as we can. So we're excited by any changes that come down, but we want to make sure that we are doing so in the proper manner.
And can you give us a kind of a ballpark? I mean, if Maine does receive enough doses, I mean, how quickly do you think could ramp up vaccination efforts if needed?
So we would utilize the current clinics that we have set up at our Northern Light facilities in the short run, which will mean that will hamper the sheer number of people that we can see, particularly those vaccine clinics that are within our hospitals, because as you know, we were trying to limit the number of individuals coming in and out of our hospitals. But we are working with the states on a plan to set up large-scale vaccine clinics that we think will serve the community very well. We will see what happens with the governor's announcement and where she would like to go and what she would like us to do going forward.
Right, great. Thank you, Patty. Next up, we have Sierra Jordan, TV7, Fox 22.
Thank you guys for having me. Speaking of going forward, how can non-essential workers receive the vaccinations?
So that's a great question that we don't have an answer to right now. I just left a meeting where the state was discussing how they can have an online sign-up process. We are hopeful that something like that will be beneficial to the state of Maine, but those decisions have not been made yet. I will say that Northern Light Health, we have been building our own internal structure so that we can make it so that people have as easy a process to sign up and receive the vaccine as possible. Some of those details, though, are still being worked out, as this is all very new to all of us, including us at Northern Light Health.
Thank you. And also, I know that this is a new year. How many people have tested negative since the new year has begun?
So I do not have the answer to that. We can certainly get back to you on where our testing is and what our internal positives and negatives are. We can get that information back out to you.
All right, thanks, Sierra. Next up, we have Owen Kingsley, WABI. Go ahead, Owen.
Thank you, Dr. Jarvis. How can people focus not just on age when it comes out to the vaccine rollout to the public, but I received a call from a woman earlier today who's in her 30s and said that she's a cancer survivor. People with compromised immune systems, how might they be prioritized in this vaccine rollout to the public?
So again, we just don't have any details about the announcement that the governor's office will be making. I know that one of the considerations was beyond just age, but other people who are in high-risk categories. I will tell you that hits me personally. I have a daughter who's a cancer survivor as well. It's one of the reasons why I received the vaccine as a healthcare worker, not only to protect myself and my patients, but also to protect my family members. And that's what I want to see for every single Mainer that's out there. Anybody who wants the vaccine, we would like them to get the vaccine. It's just going to take time. It's just an economies of scale. With the amount of vaccine that we have been receiving to date, it's the reason why we have not reached out to the general population or to high-risk category individuals as it stands now. We are hopeful to hear some positive news from the governor's office today so that we can make sure that we don't reach not only the population that is over 65 or over 70, but also those who are in other high-risk categories. So thank you.
Thank you. And Dr. Jarvis, you mentioned that you wanted to try and avoid some operational chaos. What exactly does that mean, and can you cite any examples when we get to the point where vaccines are sort of just being distributed to the public in general?
I can only speak for myself. I can't speak for either Northern Light or for the state on this one. It's my hope that we have a process that is organized so that individuals know when it's their turn to be able to schedule their appointment to get their vaccine. To just simply open something up to the general population for scheduling. We know we don't have the amount of vaccine to do that, and I just feel that's just going to make people anxious or more anxious than they already are. So I hope to have a process that is straightforward, makes sense, and is easy to follow. Right now, as we said, our practices are being inundated with phone calls for people very appropriately wanting to know when they can receive a vaccine, but unfortunately we just don't have answers to give them. And so what I'd like to see is a nice communication out there so that everybody knows where their place is in the line so that as vaccine is available, we will put it in arms as quickly as possible.
Thank you, Dr. Jarvis.
Okay, next up we have Ann, Ellsworth American. You should be unmuted now, Ann, so go ahead and ask your question.
Hi, Dr. Jarvis. Thanks for taking my questions. The first question I have is about what you just talked about, creating a process for giving the vaccines. Does Northern Light currently have a list of all its patients who would want a vaccine or need one?
So we wouldn't have a list of who wants the vaccine. We certainly have a list of all of our patients and can recategorize those by age or medical condition if we need to. We expect that we will have to do some outreach to certain populations, and so we are expecting and willing to do that. Again, my hope is that we can be a little bit more transparent and be a little bit more proactive than just us reaching out to people and allowing people to know when it is that they should be scheduling their vaccine. Again, time will tell, and I hope that by next Wednesday when we have this briefing, I'll know a little bit more. Like I said, Northern Light is building a process of its own so that we can assist in any way. It's very similar to the process that we used for vaccinating our own employees and our medical providers who have privileges at our hospitals. That has worked very well and served us well so far in the 10,000 plus people that have already received vaccine through our hospital-based clinics, and we hope that we can have something very similar for the general population.
Great, thank you. My second question is, does Northern Light have the staff to manage regular care, the COVID caseload, COVID testing, and mass immunization at once?
And that's where the operations issue comes into play. No, we do not, but we will be soliciting assistance from our partners around the state. We have done that through this entire pandemic. Where I'm based at EMMC in Bangor, our community has already started to have discussions on how we can do things, and I think Paul could have some information a little bit about on actual staffing levels.
Sure. Thanks, Dr. Jarvis. So that was a great question regarding staffing levels for the community vaccine effort. And as we understand more of the timing and the amount or volume of doses that we'll be receiving, we've had a great collaborative relationship with the schools of nursing, schools of pharmacy, and other clinical training sites throughout the state. And we have a significant commitment of potential students to provide appropriate clinical experience in a vaccination clinic setting. As well as those students following their clinical experience as part of their educational program would also then have the opportunity to become per diem employed by Northern Light as the vaccination effort continues. So we know that we'll need more people, and we are working quickly on ensuring we have those numbers of staff to meet the community needs. At this time, we anticipate having the staff that we need in collaboration with the clinical schools, the University of Maine, the community college system, Beale, Husson University, et cetera, to name just a few.
Thank you.
Okay, next up we have NECN NBC Boston. Dustin, as soon as you're unmuted, you can go ahead and ask your question.
Thanks. Dr. Jarvis, overall, how has the vaccine rollout gone, and have you had any issues with supply affecting you? In what ways might that have happened?
So actually at Northern Light Health, across all of our institutions, our vaccination plan has gone very well. I'm very proud of the team we put together. These people are dedicated. They started off with the mission statement that it is our job in a safe and effective manner to get vaccine in as many people as soon as possible. And starting with that mission statement, we have succeeded in what we have done so far and feel that we actually could have vaccinated more people had we just had vaccine. So it's a very smooth process. We've tried to keep lines as short as possible because we don't want people congregating, and so we will again replicate that as we go on to a larger scale process. So we're very delighted with that. Have we had some hiccups? Absolutely. We all were learning on the go. Very quickly, we learned that we needed a lot of space to do these vaccines because we need to keep people socially distanced. And we do recommend strongly that all people after being vaccinated wait at least 15 minutes before they depart our vaccine clinic so they can be monitored in case they have any untoward effects. And those individuals who have had allergic reactions to something else in the past, we strongly recommend they remain there at least 30 minutes. And so that requires some spacing. And so we did learn that lesson very early on, and we now have the space to be able to provide those services. And when we go to a large-scale vaccine site, we will have plenty of space to be able to make sure we monitor people and keep them safe. As far as supply chain goes, other than some day-long delays in getting vaccine to us, if we thought it was to arrive on a Monday, it might not arrive till a Tuesday. That's been the limitations of what we've seen in that regard. Really, our biggest challenge is the amount of vaccine that we're getting. It is just not nearly enough to cover what we need to do to vaccinate the 1.3 to 1.4 million people who live in our state.
My second question is, if the governor changes course on vaccines for folks 65 plus as we're expecting, what would the result be in your ICUs, your ER, your hospital beds? Would fewer people be in them than there are right now?
Not immediately. It will take time for the vaccine to have its effect across communities. That's the way vaccination processes work. And so while it is important to the individual who has been vaccinated that they have some level of protection, really from an overall community standpoint, we're still looking at summer or next fall before we see a significant impact due to whatever vaccine acceptance rate there is. The more people who get the vaccine, the sooner that effect will take place. But for the right now, we are still planning to have large numbers of people needing to be admitted to our hospitals due to COVID-19, and particularly due to the recent holidays, and we know that people traveled and congregated during that time frame. So we will still be prepared for any increase in the surge we are currently experiencing, and that's the model that we are planning for. We are hopeful we don't need to use that plan, though.
Okay, next up we have Bob Evans, New Center, Maine.
You got me?
We can hear you, Bob.
Okay, thank you. There have been several reports that there is more than one dose in a vaccine bottle. Are you getting more than one use in a vaccine bottle? And what are you doing with the leftover vaccines that would spoil if not used?
That's a great question, Bob. So really what we're talking about is that the Pfizer product comes in a vial that has 5 doses in it, and we often can get a 6th dose and sometimes a 7th dose out of those vials. For the Moderna vaccine, it actually comes in vials that have 10 doses in them, and in that one we've been able to get an 11th, 12th, and sometimes even a 13th dose out of it. I will say that that's the reason why you hear these rumors out there that sometimes people skip ahead in the line and get their vaccine earlier than they're supposed to. It's because when we have excess vaccine, we are putting it in people's arms immediately. So if we get that 6th dose from our Pfizer and we don't have somebody in the first phase that's readily available to get that vaccine, yes, we will take the next person who's around to get that vaccine if they're willing to take it. And you will see that same kind of process happen when we start talking about the general population as well. A good case in point is we have lots of volunteers who are helping us in our vaccine clinics. And sometimes they're the person that's around when we have that extra dose and we give it. We have not wasted any doses that I am aware of across Northern Light in this entire process. We are so precise in giving this out that one of our institutions at the end of a clinic had 7 vials left over, just 7, immediately reached out to the rest of our hospitals and said, who can use those 7 vials in their clinic today? And we had that shipped so that we put those 7, the doses that were in those 7 vials into people's arms. That's how precise we are. We are using well over 80% of all the vaccine delivered to Northern Light Health has already been given to people. And that's what we want to continue to see happen. We don't want to hear those stories like we see around the country where vaccine is sitting in a freezer. If we have it, we use it. If we get an extra dose, we're going to use that too. So thank you for the question.
Sure. And my second question is, it sounds like you are preparing for your staff to go out into a public space when you do get enough vaccines to do the larger scale vaccinations. How will that work, and do you know where that will be yet?
So I can't comment on a location yet. Those are things that are being discussed at the state level, and the state will work with local municipalities. And so I can't talk about that right now. All I can tell you is that we have the plans drawn out for whatever that location may be. And yes, we have staff that are very willing to volunteer to help assist staffing these types of clinics. And at the same time, as Mr. Boland stated, we are reaching out to community partners, particularly our colleges and universities, and at the same time looking to see where we can actually hire people on a per diem basis to help us. This is the #1 public health crisis we have ever faced in our lifetime. It's the most serious thing that Northern Light Health has done since I've been here for 12 and a half years, and we will get it right. We will do this, regardless of the costs or the time or the effort. This needs to be done, and we will succeed in doing it.
Okay. WERU, Amy Brown, you're up next. You should be unmuted.
Yep.
Anytime.
Thanks. Dr. Jarvis, we had a listener reach out to us yesterday and say that they had heard that there's an outbreak at Maine Coast Hospital. Is that accurate?
I am not aware of an outbreak at Maine Coast Hospital at this time. If I got more information, we can certainly share that with you. So at this time, I just don't have any details to support that topic.
Great, thanks. And my
Sorry
other
about that.
question is, what is the turnaround time now for getting results for from PCR testing in the Northern Light hospitals?
So that's a really good question. It's very variable. So it depends on what the reason is for getting the test. So we try when there's a clinical need, like somebody being admitted to our hospital, to get that turnaround time in less than 24 hours, sometimes much sooner than that. Similarly, for people who need to have time-sensitive urgent procedures, we also prioritize those testing. There are some reasons why we cannot continue to do all testing in-house and so need to ship that out to an outside agency, and that doesn't extend the turnaround time. Typically, those are things like people who are getting their test results because of travel. So there are still some delays in testing. There's no doubt about it. We are still struggling with supply chain, though for the last few weeks, that has been fairly stable for us, which is good news. But for the most part, when it's clinically necessary, we are getting those test results back in a very timely fashion and are proud of that fact, but there are still delays, particularly for certain circumstances.
Okay, great. Thank you. And next we'll go to Mary Kate, WMTW. As soon as you're unmuted, you can go ahead and ask your question.
Thank you so much. Good afternoon, gentlemen. If I could ask, I believe this was from last week's briefing that Dr. Jarvis, you said that the request from Northern Light Health for vaccine for this week is much higher than we did for the previous week. Hopeful that that need could be met. Was that need met, and how are things looking on that front at the moment?
So we did receive additional vaccine this week, which is why Mr. Boland said that we were able to start our clinics where we are vaccinating healthcare workers who are not affiliated with our hospitals. That's good news for our communities. We need them to stay up and running. We need your private practice office to be seeing patients and taking care of chronic illnesses and minor acute illnesses, as well as preventative medicine, so that we're happy to do that. Do I wish that the amount that we were given was more? Absolutely, because we have the ability and capacity to vaccinate more than we currently are, but we're very happy with the efforts that we're doing right now. Do you have an additional question?
Oh, I did. Sorry, I accidentally muted myself.
It's
Figured
okay.
that out now. Yes. And if I could ask, and this was something that you touched on a little bit, but for the everyday person, explaining a vaccine when it comes in, what needs to happen to it, and typically how long does it take from a vaccine to come in from a shipment to be put into someone's arm?
So we have had vaccines arrive first thing in the morning and are putting it into arms shortly thereafter. The Pfizer vaccine is the one that's a little bit more complicated. It is stored at an ultra cold temperature, and so our process is to thaw it first. And then it has to be reconstituted, meaning that it gets mixed with some normal saline before it can be put into people's arms. That takes time. The Moderna is a little less complicated than that. It's not stored at an ultra cold temperature, so it doesn't need to be thawed, and its reconstitution process is a little bit easier. That's why we're seeing that pushed out to like our federally qualified health centers and our smaller hospitals across the state, because they can manage that a little bit more easily. The key to remember is once we have pierced that vial, we need to use these vaccines within 3 to 6 hours after we have done that. So if we take one dose out of a vial, we need to take the remaining doses and hopefully that extra dose out of the vial as well. And that's where it becomes more complicated. And it's why right now we are not recommending that these two particular vaccines be used in private practice offices or even some small-scale pharmacies, because they really cannot manage the preciseness of making sure that you have the right number of people. I can say that when we set up a clinic, we always ensure that there are at least 5 people for every vial of Pfizer and 10 people for every vial of Moderna that we open, and then having those people in reserve for when we get that extra dose to make sure we can get those. It's a very coordinated effort. It's why we really ask for patience and why we are requiring that people schedule for their vaccine rather than just having people show up in a long line like we have done for influenza in the past. There's also a safety matter there. We don't want people to be standing in a long line together because we know that's a great way to transmit COVID from one individual to another person, and we're trying to avoid that. We're trying to make this as seamless as possible, but it will take a little bit of time, and so we ask for your patience. Thank you for that very important question.
Okay, up next, Kelly Bouchard, Portland Press Herald. You can go ahead as soon as you're unmuted, Kelly.
Hi there.
Hi, Kelly. How are you?
I'm great. Thank you very much for taking my call, my question. It has to do with something that you may or may not know about, but I wanted to ask you just because of the broad knowledge that you have of the challenges of the COVID-19 vaccination process. National Association of Chain Drugstores today is pressing for to activate the Federal Pharmacy Partnership Program. They seem to want to make it more possible for pharmacies to participate in broad vaccination. They have goals of, helping to vaccinate millions of Americans. We have seen a little bit in Maine how it's been a challenge for the pharmacies, at least for Walgreens anyway, to vaccinate folks in nursing homes and other long-term care facilities. I was wondering if you've heard about that, and just on the face of it, the idea that pharmacies could help in some significant way, or is it just a matter of, well, all hands on deck, whatever it takes? What are your thoughts on that, please?
So first of all, we would welcome any assistance in this process. Northern Light Health, nor any other hospital in the state, wants to be the sole entity that controls vaccines. We want to see mass vaccination, just like we say with influenza. We don't care whether you get it at your pharmacy, your supermarket, or whatever. But you're right, there are challenges with these two particular vaccines that, frankly, we have the expertise to take care of. And so we will partner with anybody to assist in that. But as we talked about earlier, staffing issues become a concern, and that was a concern for CVS and Walgreens in our state. And so that was some of their challenges, that they just didn't have the staff to accommodate what they were asked to do. And we know people. We live and work in your communities. We're your neighbors, your friends, your family. And so we have the ability to reach out and get those additional assistance much easier than I think somebody from outside the state of Maine. We know Maine. We're Mainers. And so, I like keeping it close to home, but we'll accept any assistance that is appropriate, and would welcome if pharmacies could assist us in some of that endeavor. I'd love to see them partner with us and work at some of our large-scale vaccine clinics. That would be very helpful. So thank you.
So we do have a hard stop at 1:30 today. Kelly, I'll follow up with you after. If you have a follow-up question, we'll make sure that gets answered for you this afternoon. And same with you, David. I'm sorry that we weren't able to get to your questions today, but I'll follow up with you after, and we'll make sure that we get answers to any questions you might have. If you haven't put in the chat that you want the high-quality audio-video file and you do want that, just let us know before you go, and we'll make sure to provide that. And with that, we'll wrap up today's question and answer session and media briefing, and appreciate you all attending, and we'll talk to you again next week.
Thank you,
all.
everyone.
Thank you.